All right, good morning, everyone. Welcome to our Wednesday morning media briefing on COVID-19 here in Shasta County. I'm Kerri Schuette. I'm the Public Information Officer for our response effort here, working from the Emergency Operations Center. I wanted to do a few things first. First of all, I wanted to give a shout out today to Mark Ewing, who is the guy who keeps us all looking good on our screens and has just been such a great help to us in making these things happen. Some of you were here, Kenneth was here, and Dr. Ramstrom and Donnell, a few people were here back when we were doing these, it seems like 100 years ago, in the Boggs building, in real life, in person, with the big microphones. And we have evolved into a much different look and feel with a lot more people, and he's kept us able to do that, and also to broadcast live to Facebook so that that not just the media can hear what's going on, but the general public can hear as well. So thank you, Mark, for your hard work on that. And I also wanted to share that we are going to be doing these briefings once a week moving forward. We're still going to be capturing the day's news and the daily update that comes out every night at it's supposed to be out by 6 p.m. We've been getting it out actually at least an hour early the past few days. We post those on shastaready.org and also on our Facebook pages, but we're going to be doing these on Wednesdays moving forward. And then, of course, as needed, if there's something that we need to share with you immediately, we'll be sure and get that information out to all of the media and post that on our social media as well. I wanted to introduce our administrative folks. We've got Donnell Ewert, the Director of Shasta County Health and Human Services. We've got Brett Gouveia, he's the Chief of CAL FIRE and Shasta County Fire Department. Sheriff Eric McGraney. We've got Matt Pontus, the CEO of Shasta County, and we've got Dr. Karen Ramstrom, who's our Shasta County Health Officer. Do any of you have anything to start with before we introduce our hospital partners? None yet, okay. And then on the hospital side of things, we've got Kenneth Luke from Mercy Medical Center, and we have Jennifer Andrea from Mountain Valleys, who are here joining us today. Yes.
Sorry to interrupt. I think Karen had something to say.
I did.
Okay.
Thanks,
Hi,
Donnell. I wasn't fast enough with my mute
sorry,
button.
not quick enough on the trigger.
That's okay. All right. Thanks, Kerri. So welcome and good morning, everybody. So what I wanted to talk a little bit about today is many of you may have heard yesterday we announced the establishment of a Roadmap to Recovery Advisory Committee, and that committee will assist with advising myself as a county health officer, as well as our work at the Emergency Operations Center. This committee will include representation from city and county leadership, including law enforcement and the business, education, and faith community, as well as our Public Health Advisory Board. The goal and purpose of this group is to proactively plan together and identify strategies and best practices across these sectors to ensure any concerns and ideas from those sectors are brought forward through these representatives, so we can strategize together and have a coordinated and thoughtful plan as we move to resumption of activities pre-COVID in a safe manner that will ensure there's not a resurgence of COVID-19 in Shasta County. So I feel really encouraged and appreciative of the willingness and interest of the group to work together in this manner, and look forward to seeing where we go from here. And we're working on getting that scheduled this week, and we will keep this group appraised of the progress of that group.
Thank you very much, Dr. Ramstrom. And that order, the health officer order, is on our website, also at shastaready.org, if anybody wants to take a peek at that. Okay, back to our hospital folks. Did any of you have anything to share before we open up to questions?
Good morning. I have kind of just a brief update. We're kind of status quo at our clinics in Fall River and Bernie. Things are moving along, and we're still promoting our e-visits for patients up in the rural areas. And we're just really grateful for the donations that are coming in for our masks and gowns from our community members, and our staff they're just doing a wonderful job. So we're really thankful for what we have going on up there.
Excellent, thank you. Okay, I think we are ready for media questions, if anybody has anything for us this morning.
Well, I'd like to ask Dr. Ramstrom, I know you're just getting the committee put together, but do you have a sense as to where we want to go and when as far as relaxing the restrictions?
So thanks for that question. You know, I think we're all aware that we, at this point, we're under the umbrella of the recommendations and requirements that the governor has set forward in the stay-at-home order. And so I envision us coming together and planning for the unknown time. We are hoping it's going to be soon, where he begins to loosen some of those restrictions, in particular as there's we move to where there's not a distinction anymore between especially essential and non-essential businesses. You know, we're hoping that that will come sooner than later, particularly in areas that are not hard hit. And so we're going to have to see how the governor goes about that. Our hope in ourselves here in Shasta County, as well as some of the surrounding areas that are also in a different situation clearly than, for example, you know, Santa Clara, the Bay Area counties, LA, that we may be able to move forward sooner than others, but we don't know how the governor is going to go about that. And so what I can tell you is that right now we're in what is being called phase 1, which is the tightest level of restrictions. And we are hoping to move into phase 2, which will begin a gradual loosening of those restrictions. And we're going to be in phase 2 for the foreseeable future. And that's going to continue until we have a vaccine or medications or both that will provide some protection for our community. And so that's going to be a good 12, 18 months out. So we're going to, my hope is that with this committee is that we can plan for how we are going to live in phase 2 and gradually increase that those activities over time and work together to make sure we do that in a way that we can be nimble and be responsive if our numbers shoot up, because at that point we'll be at risk of, other individuals potentially bringing the virus to our community, or our community members having to go for essential business or essential services out of the area and bringing it back here. And so that's sort of the time frame. There's not exact timing right now, but that gives you sort of the parameters.
Thank you.
Other questions?
Would phase 2 allow for any public gatherings of any sort?
Yes, so I anticipate that public gatherings will be gradually increased in terms of the numbers, starting something like 10 up to 50 and then gradually increasing from there. At the same time, it's important to remember, and part of the purpose of the committee is that while we're in phase 2, we still have no community immunity. And so the activities of this committee, and which applies to the public gatherings as well, is to ensure we have social distancing built in to how we implement those increases in activities and the number of public gatherings that are allowed. So yes.
What do you think the chances are for the fair at the end of June?
At this stage, I can't really predict, depending on what the governor does and when he does it, we'll get a better feel for how vulnerable we are in our county to the virus coming to us. And I think that some of these decisions are, it's hard to anticipate what we will do right now. Most large gatherings like that have been postponed or put off, but my understanding is the decision hasn't been made yet. And I think that that's a discussion that's, going to need to continue, and hopefully we'll have more information soon.
Dr. Ramstrom, I'm sorry, did you say 12 to 18 months is what you're predicting for phase 2? I missed that for a second.
Right. So as we've talked about, we really cannot move out of phase 2 until we have an effective vaccine that has been widely disseminated, and or medications to treat this infection. So right now we don't have adequate community immunity to protect ourselves, and so it's going to take that long to actually develop those new medications, and so that's why that time frame.
And then, oh, sorry. Oops. Who's talking? Oh, I'll just chime in again. I was also going to ask, I saw how Humboldt County is now going to be requiring masks for people in most cases, and they essentially tied it to the economic piece where, if we want to get things going again, we need to find ways to make it more safe for everybody to be out in public. That's kind of what they indicated. So I was curious, is that, would a mask requirement, do you guys think that would ever be on the table here? And, if so, why? If not, why not?
It's a good, I think we've been talking a lot about that, and it's been discussed amongst my colleagues in other counties and with the state public health department. I anticipate a potential need for a requirement. What that would look like exactly, I don't know at this point. Again, it really depends on what the governor does. I can tell you that there are mixed feelings around the mask requirement, but I think the takeaway is that if we are going to allow loosening of the stay-at-home order, and so we will be interacting more with larger groups of people, and potentially in settings where we cannot maintain social distancing as much as we would like, then masking may be required. Right now, it's recommended. We're in the process of getting additional information up on our website about what those recommendations would look like. And they've been out for a while. Even going to the grocery store and such, you start seeing more people, which is a good idea because if you're in a situation where you cannot control people around you, then that's the purpose of wearing the mask. And so in fact, it actually protects more people around you than yourself, but it does provide you some protection. But there isn't a lot of science, and so that's why the state has not necessarily put out a statewide order, and we'll see what happens, but we'll just have to make decisions as this plays out.
I just want to add something to Dr. Ramstrom's comments, and that is that I do think we need to try to manage expectations a little bit. Once again, the state's health officer order is in effect in Shasta County. We cannot do less than the state health officer is mandated. So we can't change anything until that order is lifted. The state may institute a different order, or they may leave some flexibility. So it really remains to be seen. And there's going to be a gradual relaxing of the measures, and yes, we do want to see business open up. We do know that there's a desperate need for that in our community. We know that unemployment and business failures is not good for people's well-being either. So that's a deep concern to us. But we just need to keep in mind we want to prevent a resurgence, and that we're going to need to do gradual relaxing of these measures. And so I just want to make sure folks aren't thinking we're going back to January 2020, because that isn't going to be happening.
Donnie, I see that you're unmuted, but I don't hear you. Have you started speaking yet? We cannot hear you. If you want to email me your questions, if that's really quick, then I can ask them for you on your behalf if you would like. What other questions do we have today? Okay, I am hearing nothing. In that event, if I know, Donna, you didn't get to ask yours. If you want to email them to me, I can do my best to get answers, written answers to you if that's okay. And if no one has anything else to add, I will wish you all a happy Wednesday. And we will see you again next Wednesday at 11 o'clock, same place and time. And we will continue to send out our daily updates. So you will not have any less news than you've had in the past. We're just going to be doing it a little more in the written format than we are in the news briefings. So thank you very much. And we will see you all next week.
Thank you.